Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I think we all kind of know that if we're all hunched over our cell phone, it's probably not good for us. But yet, the cell phone, it's so alluring. Like there's so many beautiful things on it. And probably if we're all honest, we're all kind of addicted to our cell phone and the things on it. I just want to review an article. So the article is called Assessment of Stresses in the Cervical Spine Caused by Posture and Position of the Head. So we all know basically, we're all basically in this posture where our neck is flexed. So this article describes that basically as our neck gets more and more flexed, the pressure on the ligaments and the musculature and everything of our neck keeps going up. When our head is aligned, so in other words, basically our ear is over our shoulder, then there's basically just the head weight, which is like 12 pounds. But when you go forward by 2 inches, then it goes to 32 pounds. And when you go by 3 inches, it's 42 pounds. So imagine like how much pressure there is on the ligament structures of the neck and the muscles of the neck when you're like that. And the average person is, 5 to 7 hours a day. And then this basically just shows it. So forward head posture from hours of computer work and texting resulting in cervical ligament laxity. So in other words, when a person looks down or they look, so this would be like the average position when somebody's looking at the computer. So you see how the spinous processes here, the cervical vertebrae, they get further apart. So that's stretching the ligaments. And imagine when they're looking at a cell phone, they're even further apart. And then eventually the ligaments stay in a stretched out position. So now the person has lost the cervical curve. So the most common reason that I think people have ligamentous problems in their neck or cervical instability is basically the positions that they're in for hours a day. It's not traumas to the head. It's not whiplash injuries like from car accidents. I mean, that can do it too. But all of us are in the process of slowly stretching ligaments. And the term that we use in modern medicine for the slow stretching of ligaments is called creep. And basically, you kind of know that your ligaments are always in the stretched out position. In other words, you now have ligament laxity or ligament injury is when your muscles of your neck continually have to tighten to stabilize your neck. Like if you always feel like it's always tight here and I always have tension here, well, I'm telling you, you probably have upper cervical instability. And if your muscles are always tight here, you probably have lower cervical instability. And this is basically what happens. The head gets more and more forward. And the problem is, if your anatomy is always like that, basically you're going to start compressing the jugular vein, which then the brain doesn't drain, so you get increased intracranial pressure. And then the yellow here represents the vagus nerve, and you get vagus nerve degeneration. So increased brain pressure, that can give brain disease like brain fog, memory problems, focusing problems. And when your vagus nerve becomes degenerated, that's when folks can get tachycardia, heart issues. They can get where the digestive tract doesn't work so well. So common symptoms that people come to Caring Medical for are nausea, bloating, slow motility of the digestive tract, so constipation, and even things such as food sticking, swallowing difficulties, dysphagia. These can all be signs of ligamentous cervical instability. And unfortunately, one of the main causes is the increased pressure on the ligaments from looking down, forward head lifestyle.